Good morning and happy holidays. Thank you for joining us this morning to learn more about how hospitals can drive new revenue from creating new employer relationships. As we approach 2016, employers are facing higher than ever insurance premiums, pharmacy rates are going up, and employees seem to be getting sicker instead of better. It may be hard to believe, but the health system is integral to alleviating this financial drain on employers. When the hospital is at the center of prevention and wellness, the health system works. Hospitals are trusted resources, but employers are slow to understand the hospital's role in prevention. When the hospital connects with employers, they are also able to drive new business back to their other service lines as employee health and wellness improves. During the next 30 minutes, Chris Careening, the CEO of Strategic Health Services, will provide an overview and unique perspective on the employee health problem today and how we are finding answers by connecting hospitals and employers in their communities. My name is Susan Plumer. I am the Vice President of Healthcare Sales for Strategic Health Services, and I will host a question and answer period at the end of this webinar. At any time during the webinar, if you have a question, please feel free to type your question on the toolbar on the right side. As you will also see, there is a PDF of our new directions brochure. This is a more formal approach to community outreach, which you are free to download at any time. So now I would like to turn it over to Chris.
Good morning, Susan. Good morning, everyone, and happy holidays, and thanks for joining. It's a pleasure to be doing this webinar. We've done it probably 6 or 7 times before, and it's been a great conversation piece to help us talk through our position around healthcare, prevention, wellness, population health, and the role that we can play and our hospital partners can play in improving it. So I'm excited to give it to you today, and just a few days before Christmas. What I wanted to do is I wanted to kind of set in motion a little bit some thoughts around where this healthcare excess problem came from. And the reality is that the healthcare problem came from a cultural issue. And so if you think about Pink Floyd, The Wall, so I'm kind of dating myself, but there's a song in there where it talks about the fact that if you don't eat your meat, you can't have any pudding. In the UK, puddings are desserts. And so what this is culturally telling us is that we've kind of conditioned ourselves that we're eating dessert. And that's led to an obesity issue in America, which has led to a myriad of healthcare issues. And as employers, the employers bear the cost of these lifestyle choices. Essentially, it's an unbalanced equation. And we're taught in chemistry class, in high school chemistry, that in an unbalanced equation, we need to make sure that the equation balances. So if there's going to be a chemical reaction to take place, we need to make sure that whatever happens on the left side of the equation is equaled out on the right side of the equation. And so much like that science lesson of balancing equations, and much like the cultural issues that we talked about, I was working in our Franklin, Tennessee office once, and I thought that I would go up to P.F. Chang's and I would get a healthy meal. I'm a bigger guy. I'd always been struggling with my weight, and so I said, I'll go get a little stir-fried chicken, some brown rice, and maybe some lettuce wraps, and maybe I'll treat myself if I have a glass of red wine or two. And so when I started to look at what the calorie content would take, and I started to think about this cultural problem that we have, without dessert, that menu, that order from P.F. Chang's would have calculated 2,100 calories, and not to mention the sodium that was off the charts. And so if you think about it, it's virtually impossible for somebody that's trying a healthy lifestyle that doesn't understand what these fast food restaurants or chain-style restaurants have done to increase calorie content versus cut their price. They've heaped on extra servings, and they've created a plate that's over full. And we've culturally learned to eat that entire plate. You've got to finish your meal. You've got to finish your dinner, things like that. And so what that's done is it's left a healthcare unbalanced equation that we all know inherently But the problem is, until recently, we haven't had the tools as consumers to better manage those, and we haven't had the education from our healthcare system and its infrastructure to tell us how to manage that. Nobody would argue the fact that if you intake 3,000 calories, you go ride a bike and you output 3,000 calories, you don't gain any weight. If you intake 3,000 calories, you watch TV, which only takes 2,000 calories, you're going to gain weight over time. And the opposite is true. If you intake 2,000, you output 3,000, you lose weight. Nobody would argue with that. The problem is that there haven't been enough tools and there hasn't been enough education to make it easier to manage. And so what that's created is an obesity problem, which has spun off a series of other problems who, as employers and as health systems, we need to deal with. And so whether that's the obesity rate driving hypertension or high blood pressure, or whether that is the obesity rate that is causing musculoskeletal issues, and at the end of the day, it comes about because we're intaking more than we're outputting. And so problem is that wellness has been trying to be the solution. But for 20 years, wellness has been driven out of the payer side of the business. And it's very, very difficult for the payer, who is seen as a kind of the anti-consumer in the process, to be driving people into wellness activities. And so these preventative measures have not become mainstream or have been adopted mainstream because the payer has been the linchpin. And so what we're looking at that traditional wellness model as being broken. And so in our population health model, the health system, the local health system, now becomes the center of health and wellness for the community. And we'll talk about this with some really interesting examples. But if you think about it, if you're a local school system, your employees are in the local municipality, that local hospital is your linchpin to medical service when you're sick. But it also should be your linchpin to medical service when you're well and prevention. Most health systems have an infrastructure of primary care physicians, specialists, subspecialists, so they're well equipped to manage folks in this new model. The experts are telling us, whether it's the CDC or in the next slide, modern healthcare, that prevention is the key. And the problem is most wellness programs do not focus on prevention. They focus on fitness services, getting your blood test, getting some nutrition counseling, and all those are very noble areas. And our folks manage that, and our hospital partners manage those as well. The difference is that programs that we sponsor also feature a gap in care and heavy dose of prevention. And that prevention is what moves the needle economically in the first year. So finding somebody who has never had a mammogram gets discovered with stage 1 breast cancer, well, it's very treatable and treatable locally. Somebody who is hypertensive and gets on blood pressure medicine and avoids a stroke. All those kinds of things are things that get managed through gap in care and through prevention management when the health system's involved. I skipped over this slide with Louisiana, but I wanted to come back to it. I love New Orleans. I love the state of Louisiana. I've done a bunch of business there, and it's just a treat to go visit. People are fantastic. Food is incredible. But everything you eat there starts with a quarter stick of butter. And so if you think about it, in the state benefit plan, one of the administrators discovered that only 27% of the workers that are on the state insurance plan got a physical last year. So if you think about the state of Louisiana and you're trying to manage your budget and you're trying to do the right things for your constituents and you're the governor, how can you possibly do that when only less than a third of your folks are going to the doctor? And these are folks with fairly rich benefit programs. And so the problem is that the incidence of shot claims or very large catastrophic claims is increased or elevated, which makes it very difficult for the state to budget. Again, gap in care and prevention. This is an example of one of our clients in Texas. So this client here represents a fairly large group. But as we can see, most of the folks here have been screened for this in the last 12 months. So there's been 9,500 folks that have had a physical exam, 6,800 folks that have had a pap smear, 4,100 that had a mammogram, and 1,000 have had a prostate exam. And so those are great. And the problem is most hospitals try to market, and the only marketing they can do is towards those folks there that are doing something. So whether they put up billboards and they talk about the professionalism of their doctors or their outcomes or all kinds of things. What we see in our clients is a focus on this side of the equation. These preventable claim opportunities exist. So here are 2,700 folks that have never had a physical exam. This data was comprised by health risk assessment data, so member-sponsored data, and also combined with claims data. And so we feel fairly accurate in these numbers. So right now, there are 2,700 folks that have not had a physical exam. Well, if you're the local health system and you have a large network of primary care physicians, there's 2,700 new opportunities for a primary care visit. And let's face it, we understand healthcare. If somebody hasn't had a primary care visit in a very long time, then clearly they're not just going to a primary care doc. There's probably subsequent services, whether it's an endocrinologist, a cardiologist, some other specialist. So this is where the opportunity is for the health system to not only help the employer in a partnership make more money, save money in terms of their benefits plan, but also drive health and wellness. These are things that a payer could never do in the old model. And so the employers recognize this because for every dollar increase in employee healthcare costs, the employer's percentage of that has increased $3. So the employer, even though the employee is feeling high deductible health plans and things feel much more expensive, the reality is on the employer side, they've more than tripled those costs. And so these are the kinds of things that we believe that a true partnership with your local health system can prevent. And so let me give you a great example in this slide. Let's take that school system that we mentioned earlier. If you're the administrator of the school system or even that state of Louisiana benefits administrator, you've got some folks that just joined the organization. They're low-risk members. Perhaps their lifestyle choices haven't caught up with them, or they just happen to be healthy folks to begin with. And then you've also got retirees on the program, and those are still in the benefits program, and you're still administering and paying benefits for those folks, and they require complex care. When you inject the local health system, you can manage this entire gamut, whereas today, that local school system is paying one organization for prevention, they're paying another organization for disease management, and maybe even paying a third for case management. The interesting thing is, in our newly connected, meaningful use connected healthcare system, none of these three vendors talk to each other, and we know that none of them talk back to the local health system. So nobody knows I'm being treated for hypertension. Nobody knows that I'm being monitored and I've had 5 blood pressure tests in the last 2 months. Nobody knows any of that data. And so that data is not shared. But when the local health system is the administrator of this plan, then all of a sudden this data becomes apparent and becomes shared and readily available. And we know what the cost of managing these things are. If we don't better align the incentives, the employer is going to spend more money. Blood pressure costs almost $1,400 more annually. Tobacco and nicotine costs almost $5,000, $6,000 more annually. These numbers are insane, and these are driving the cost of our healthcare system to increase. Employers understand these numbers, but they don't know about them. That's why they need the partnership with the local health system. So our innovative approach makes the local health system the purveyor of health and wellness. It leverages the nurses, facilities, doctors, their preventative care mechanisms, their infrastructure, and they can manage these wellness programs. It also allows the health system to build and form new relationships in their community. And that begins to segue into narrow network products, and other additional products that the health system may want to sell to the employer. The reality is, folks, this balanced equation is true, and I'm living proof. When I took over the company in February of 2013, I was well over 300 pounds. Today, I'm a little over 240 pounds, and I'm continuing to manage and stay healthy. The reality is that using the tools that Strategic provides, using a health coach to educate me on that P.F. Chang's experience was key in me understanding what I was eating, what I was exercising, and where the delta was and why I was gaining weight. What we've created at Strategic Health is really a community engagement platform. And this platform can be pushed out to anybody in the organization or in the community, whether it's an employer, a community service center, a hospital-sponsored, a health system-sponsored gym. We've seen incidents of all these. So on the left-hand side, you have what I call consumer connectivity. Any device, any application can be connected and brought into the platform. We have a personal health record so that if the health system is in a heterogeneous computing environment and they need to have a sponsored health system, personal health record to achieve meaningful use, ours will work and it can bolt right in behind the health and wellness program. We do our claims analysis from MedAI, we have incentive management, and then our secret sauce, because we're healthcare people, is we can export our data out to the modern healthcare electronic medical records. The next thing, once we created this platform, that we realized was that health systems are so busy in focusing on their daily operations that they don't have a great competency in sales and marketing and how to transition from fee-for-service to fee-for-value. And so that whole notion of business development is something that we don't. And so let me give you an example here of a group analytics report that a hospital could present to a local employer. So when the hospital meets with the employer, having a discussion about the health of your employees is one thing. Being able to show the employer that 16.3% of the local employees have high blood pressure, and having a discussion with that local employer about what happens at a health system when high blood pressure goes unchecked, that it could easily turn into a stroke or other complications, and that, by the way, the cost to treat a stroke is extremely expensive, is a much more rich and significant conversation with that local employer. So what we created was New Directions, and New Directions is really our marketing and revenue generating program to help hospitals and health systems go into the community and form these relationships. So we've built our strategy on Strategic Health, taking our products, selling them to hospitals and health systems, letting those hospitals and health systems use them for themselves, improve, and then helping them take them directly into the community employers. We can help them in a variety of ways with those community employers, from figuring out exactly who they need to target, and also figuring out how to brand, how to link those services together, and how to reduce costs overall and manage and track that. So let me show you an interesting example. We have a couple of very cool clients. The LA Dodgers is one of our cool clients. Jennifer is an employee at the LA Dodgers. She was pre-diabetic. The Dodgers asked the team to focus on folks that were pre-diabetic in our coaching and our outreach efforts. And we did that because the Dodgers understood California or Arizona, where they have most of their employees, an employee that becomes diabetic would cost the health plan $13,000 additional annually. The Dodgers are self-insured, and so they write their own checks. Most people think about the Dodgers as the 24 people that men that go on the field, and the managers and the intro. What they don't understand is the Dodgers are like any other business, and they have 600 or 700 other employees that are doing everything from accounting and to administrative services to marketing and sales, and all those people on their Dodgers benefits plan. So the reality is that Jennifer, like me, was out of balance. She had gotten her job and her life and her family had gotten in the way of balancing what she ate, how much she exercised, and bringing that equation into balance. And once she did that, her pre-diabetic state retracted and she lost weight. She's healthier and she's living a healthier lifestyle. That happens because of the analytics and the targeted interventions that we're able to create. So helping the health system present data to its local employers to provide the opportunity to recommend services. So whether it's blood pressure, as we looked at, whether it's cholesterol, or even because we analyze the claims, understanding places of service. So whether that employer had employees that shared their healthcare dollars with many other health systems in the local community, and having the opportunity to consolidate that. In this marketing effort, we've created templates for the health system to use. We've created everything from market-based prospect lists in the bottom left-hand corner, to helping sponsor health fair events in the top right, to the tools and data that is necessary to launch this program at the local employer. Here's a great example of Valley Baptist Health System. I call this their menu of services. Valley Baptist is located in southeastern Texas, about an hour and a half or 2 hours below Houston, in a fairly rural oceanfront community. They have several large employers in town, and they also have school systems and municipalities. What they've done is taken this menu of services that we help them construct, and they've baked strategic health products into there under the Valley Baptist logo. So Valley Baptist does health risk assessments, which is our technology underneath. They do biometric screenings, which is their phlebotomists and their wellness folks. The claims analysis is done for Valley by us. Their online wellness portal is ours. Our on-site education seminars, the Valley team does. In southern Texas, diabetes is a big issue. And so they have a very specific diabetes medical management program because they know that most of the local employers will need that program. And so that's on their menu of services. They also do personalized health coaching and benefits design. And so this is just one example of how we've partnered with the health system to bring a wellness product into the marketplace in Harlingen and Brownsville, Texas. Some of the ways that we launched those, our good friends at King's Daughter Medical Center in Ashland, Kentucky, went out on the left-hand side. You can see a letter that their CEO sent to their local community. They sent it to over 100 local employers, and they created an event to learn about occupational medicine, health and wellness, customized solutions, and incentive programs that the hospital could bring to their local employers. This was an invitation-only lunch. Strategic Health participated in the lunch and presented, but clearly King's Daughter was the shining light here. The local library benefits administrators signed up literally at the event because they felt compelled that the King's Daughter solution was better than any other wellness solution that they had seen. In examining King's Daughter's community outreach, we helped them identify local employers, whether that's a steel company or a chemical company, the education system with the boards of education, or local food company like Brown's Foods, which is a third-generation family-owned food distribution company. They have a very strict partnership with King's Daughter, and they're driving the benefits of health and wellness, sponsored through the health system. This has created a real win. For the health system, patient volume goes up, and it's patient volume of insured folks, and it helps feed their primary care network. In addition to the employers gladly want their employees to participate in these programs, but they have no way of doing it. It's not like the employer can come and say, hey, Bob or Sally, you're a great employee, but you haven't gone to the doctor in 2 years, so if you don't go tomorrow, don't come back for work. But the local health system can be that nudge and that trusted entity that can get the employee to join the health and wellness program, can go get their primary care and prevention services. And so for the health system, we see volume increase. For the employer, we see health risks and health costs go down. when prevention and health and wellness is managed through the health system. The reality is that third-party wellness companies just don't stand up to the hospital-driven solution. Gap in care prevention provides the short-term ROI, and the consumers are fatigued with, the biggest loser contest. The health system must stand into this process and become part of it, or as the volume switches from fee for value to fee for service to fee for value, then all of a sudden the health systems are going to end up with the cost of those folks pushed upon them. What I want to do now is stop, and Susan, if you've got any questions or if any of our audience has any questions, I'd like to take a couple of minutes and answer those.
Great. Thank you very much, Chris. So there have been several requests for more information on the sales and marketing support that we provide. So I will personally follow up with everyone and send you out additional information on all of those, on all that support. One of the other questions that came in, Chris, was if I have a program in place for my employees, can I use this just for outreach?
Yeah, so we've seen hospital systems transition over time, and we understand that there's often programs that are in place, but what we see is that people start with the outreach program and then they come back and get their employees. Some health systems start with their employees and then go to the outreach. It really matters from a budgetary perspective how that transition works, and we can work with you to figure out what fits right. The goal is to be able to represent to the community that the health system is doing something with their employees because they're a large self-insured employer as well, and so they have the same challenges that those employers do.
Okay, great. And actually in the same vein, another question came in. If I want to roll this out for my employees and outreach, is there two different portals, and how are they branded?
Yeah, so we can brand them any way that they want, and so that's fairly easy to do. We have seen hospital clients that want to use our health coaches for their employees and then use hospital employees for their outreach efforts. That's perfectly fine. We've seen some that do it all in-house. So we're very flexible in how we bring this to market. Our belief is that it just needs to happen, and we need to be the infrastructure that helps make it happen. So our goal really is to accommodate the health system in their journey to this process, however best they need it.
Perfect. And I'd just like to add for those folks that are on the line that the implementation time for building these portals is less than 30 days. So for your employees can be up and running in less than 30 days, and then for the outreach, the portal can be built, and as it's being built, we will build your marketing and strategic plan at the same time. So it is a pretty quick rollout. Well, that concludes our webinar for today. I'd like to thank all of you for spending time with us before the holidays and wishing everyone a happy and healthy holiday. Like I said, I will be following up with a marketing and sales materials for you, and if anyone on the line would like a demo to see this consumer-facing portal as well as our coaching and our back-end platform, please contact me and I will be happy to set up a demo for you. So that is it for me. Again, thank you and happy holidays.
Absolutely. Happy holidays, and thanks everyone for attending. We appreciate it.